fully planned out, yet flexible. Which is a really hard thing when you think about it. If you've done all this preparation, right, for your wedding, let's say, the biggest event of most people's lifetime, how can you be flexible? Say your best man's running behind. Can you just move it back an hour? I mean, I think most people just blow up, right? Or, you could blame yourself saying, why did you choose this guy who is always known to be late? But anyways, the thing is, I realized when you go to an appointment, yes, I've already had a strategy how to approach this doctor, how to get what I want. But I'm also flexible. I take cues. I see how they approach me, and I change correspondingly, right? So recently, I wanted to get some MRI of my spine. I actually sent a message to my primary care doctor who said, this is too late. You already have some weakness and, pain in your hands, and you just better get the MRI done sooner because my appointment with the primary doctor is in a week. I already made it like 2 weeks ago. It's just, everything is so long booked out. And I know that to schedule an MRI takes at least a week, if not longer, right? So that's the thing. I was going to go to urgent care with the goal of getting an MRI of my spine. I was thinking, it would be nice if they did it of my whole spine, not just my cervical and thoracic, because hands are really cervical, thoracic, upper thoracic. And then legs, I have this sort of strange pain, weakness in my lower leg. And it's just one of these weird nagging things in your head, whereas the strange old doctor in Vietnam said, I want to MRI my leg. He's like, no, I want to get one in your spine. It's like, why? And my friend said, her husband actually discovered he had spinal stenosis and he needed surgery, right? But he had a lot of calf pain. And that's sort of, anyways, get it done with. I already have 2 out of 3 sections of my spine, I'll just get the 3rd, right? But it's not so simple. You can't just tell them, just add it on, right? So you have to go through a doctor, get the doctor to order for you. And so my strategy was going to tell the doctor this, that, right? But, right, when I actually, and then, throw the doctor card out, right, say my doctor wanted it, but actually it didn't quite go that way. The first thing I noticed this doctor is she was sort of saying she had to adjust the computer. And so I was like, oh yeah, ergonomics is pretty important. And then we just started talking about that, just the icebreaker, right, opener. And then we started talking about that. And I was like, yeah, I know what you're talking about at work because, I'm a hospitalist. I do locums just like she's per diem. This is all temp stuff. And so I feel bad for adjusting the table because, this is not my table. She's like, oh, and she completely understands. And we talked about some other stuff later about how meeting our deductible, how, mine is already met. So, that may have been a block. She doesn't want to give me a lot of expensive tests, but if it's already met, why not? It doesn't cost me anything, right? And then, she was like, oh, but I need a reason. You don't have the warning, the red flag signs, which are, bladder, issues. And so one approach is saying, the attitude of, well, you want to prevent things from getting worse, right? But then I actually use different angles. So one is that you want to make other people happy. And she said, oh, you mean patients? I said, no. This is Kaiser. You got to make your colleagues happy too. And I sort of was this more senior person, even though I'm younger than her, because I've actually worked at Kaiser and I trained at Kaiser. I know a lot about how Kaiser works. But I told her, look, in the hospital, when one of the clinic doctors asked me to do a test, like, in the past I may have said, no, it's not indicated to patients in the hospital. But now I just say yes, right? I want to make them happy. Does my job security depend on Kaiser thinking I order appropriate tests? Or is it more important that Kaiser compares about complaints from other doctors about me? I'm gonna say complaints about other doctors, complaints from patients. Those outweigh any medical competency, I can tell you by far, at least at Kaiser. Maybe true in most places, right? Collegiality, that's very important. And then the next thing is also the angle of why she should do what my primary did. Because she's doing him a favor. Right? Because I actually don't have any imaging of my spine. I know I have a herniated disc because I get an outside image, but that's not in Kaiser's system, and technically they don't have them. If you went to court, Kaiser has no leg to stand on saying they did imaging because they did not. And taking a patient's word and not having it yourself, that's doesn't count for anything, right? Because we all know you can't, if patients say this and it's not, it's still your fault as a doctor. You should have known better than to trust the patient blindly. So I use that angle too. Maybe my doctor's worried about liability. You want to do him a favor, which obviously makes her feel good about that. Because again, she's sort of new, wanting to make other people happy, even though they don't know. But she doesn't want to get complaints because she's a temp. And then the last one, right? I walked her through it, right? So the test ordering, right? She was like, oh, you know, the C spine, T spine, because the C and T spine both make sense, right? Because hand goes to upper T spine, and I do have some tenderness on my upper thoracic area. But the lumbar spine doesn't make sense. It's just an additional one. I thought just might as well do the 3, right? Because it's leg thing, and that's not really urgent. I agree. I thought it'd just be easier to get it done. But when she actually pulled up the test, because she doesn't order these tests commonly, which I in the hospital do, didn't really know which one to order. She turned the screen to me and asked me. And I said, oh yeah, I would just, click on that one. As in, she could order C spine and T spine independently for MRI, but that's 2 separate orders and it's more difficult to duplicate your writing. So I said, sometimes at Kaiser, realistically, it's just easier to click through stuff, even though it may not be, because you want to help your patients. I took away that block she had, right? She had a lot of blocks about Kaiser, watching what she does, all this stuff. I could tell you, I work in Oregon where they're much more strict watching you, right? They took away in the hospital, I can't even order a lot of tests because they took it away. And when I worked in other Kaisers, like in Bay Area, I'm sure it's the same in SoCal, they don't take those away. That's ridiculous. But anyways, over here, it's much more concerned about patient satisfaction, and they don't bother too much, right? And the funny thing is, later she actually called me back, wondering if she should order some x-rays, and I said, I usually just go straight to the better test, right? The x-ray is not going to show anything, right? And if you show something, you need this better test anyways, right? So a lot of it is reassurance, telling her it's okay what you're doing, you're not going to get in trouble. That's what she really needed. After we connected, right, with both being temp doctors, working at Kaiser, and then I could able to give her some reassurance, and thus I got all the tests ordered, right? And the thing is, I didn't get my MRIs that day. They said they didn't have the ability to do it, and that's correct. They didn't. But I'll get it done in a few days, which is much better than a week or 2 later, right? So I got what I wanted, and I had a plan, but you have to be flexible and realize people come from all different places, all different paths in life. And I think one thing is the more people you have an interaction with, you know how to approach all these different types of people. You could get a sense of where they are, what motivates them, and then approach them differently. And that's why you got to be prepared, be fully prepared, and completely flexible. It's going to give you the greatest chance of success of getting what you want at your doctor's appointment.